in a broader sense, I know that you are a person who stands for budget cutbacks and reduction of the federal budget. And what I would say to you is be careful in looking at budget cuts as it relates to health care and the limited access to medical care for people who live in rural areas such as northern Wisconsin. Specifically, there are two things that I think are issues that need to be addressed and need to be looked at very closely. The first is Medicare and Medicaid reimbursement. That continues to be an issue for everybody, and everybody as they age especially, and especially those people living in rural areas. It specifically relates to the Memorial Medical Center as you look at the critical access hospital reimbursement rate. And then the other issue is the ability to be able to get providers to come to rural areas because of the reduced reimbursement for those providers. So it's not a question, it's a comment, and I ask you to think about that in the long term about care and health care for people in northern Wisconsin.
Maybe if I can respond with a comment to the comment. First of all, I'm well aware we're a small rural community. A lot of rural communities throughout this district, and we need this critical access care for our hospitals to make sure that they can succeed in smaller communities. And so I have worked with our smaller hospitals, communicating with them to make sure that that continues. So make no mistake, I'm well aware of how we survive and our hospital systems survive in our communities, and I have been a supporter of that. When we talk about budgets, quickly to be clear as well, we have a $15 trillion debt, right? We borrow $1 trillion a year. What we have talked about on our side of the aisle is not budget cuts. We've talked about budget caps. Let's cap our spending. Stop growing it. Stop increasing the spending levels. Cap it. And if you go 5 years forward, which was our budget proposal of a cap, and then let it slowly grow, that's how we're achieving a lot of our savings. So we're not, there's no slash and burning going on. It's saying stop spending more every year. If you just would cap it at the current levels for a length of time, we can be successful. And it doesn't have a huge impact on a lot of programs that are vital. And when we talk about Medicare reimbursements, I think that's important to note as well. The president in his health care reform bill set up what was called the IPAB board, the Independent Payment Advisory Board. Are you aware of that board? Okay. What this board is going to do is look at Medicare reimbursements, and they're going to look at where they can reduce reimbursements to doctors, hospitals, and clinics to try to balance the Medicare budget. And I don't know if you can, our Medicare reimbursement is incredibly high right now, that you have a lot of cushion in there, a lot of profit in the Medicare reimbursement. No. You cut Medicare reimbursements even further, the line goes like this. We can pay the hospital doctors and clinics less with the Medicare reimbursement, but don't you worry, seniors. You're still going to have the same access and quality of care. We're just going to pay them less for it. If you believe that, I've got some good swampland in Florida for you. Of course it's going to affect your access to care because the hospitals can't afford to provide the same quality and service if you reduce the reimbursements. But that's what's happened in the new health care reform bill. That wasn't my bill. That happened before I got there. But if you care about Medicare reimbursements and seniors' quality and access to care, you care about the Independent Payment Advisory Board because they're going to reduce reimbursements. And it's a real threat to our current seniors and their quality and access.